Today we're going to go over start, jump start, triage, start more so than jump start, which is what we use pre-hospitally. We work under the guidelines of the National Incident Management System, which is a federal system that basically puts everybody on the same page. So this start triage, if you go to California or Minnesota or Texas, they're all going to know start triage because it's a federal system, so everybody's on the same page. Basically, it's a simple system that runs on, and I'll give you a card, right? On the front it says start, on the back is jump start. Jump start is for pediatric patients under the age of 8, and we're not going to deal with that today, okay? But start is for adult patients. Now, how do you know they're 8 or 9? If they have any signs of puberty, then they're an adult, okay? That's basically it. So underarm hair, breast development would make them an adult, okay? So if you look at your start, and this may be a little confusing, we actually look at 3 things: RPMs, respirations, perfusion, and mental status. Okay. So a mass casualty incident is when we would institute this, and a mass casualty incident could be as few as 5 patients and as many as thousands. Okay. They used this system in New York when they had the Trade Center. They used it in Oklahoma when they had the Oklahoma bombing. So this is a system that's used pretty frequently pre-hospital. Once you get into the hospital, they have other systems. But what this system is set up to do is do the most good for the most number of patients. Okay? So unfortunately, sometimes you have to come up to a patient and say, I can't do anything for him. I need to move on. Okay? And that's one of the hardest things about this system. But what we need to remember when we have hundreds of patients, if we spend too much time with patient number 2, is patient number 99 going to die because we spent too much time with him? Okay? So it's the most good for the most number of patients. He's supposed to, or she's supposed to direct all the people coming in and what they should be doing until somebody takes it over from them. The other person should be doing triage. So sometimes it's only one person initially doing triage, which is the tag system or the tape system works very quickly. So we start out, when we get on scene, first thing we're going to do is say, everybody who can walk over to that tree and sit down. If they can walk over to that tree, they are considered a green. That means they're not really hurt that badly. We don't need to worry about them right away. When we get people on scene, more people than just 2 or 3, we're going to send somebody over there to secondarily triage those people. So if they are having a problem, we will pick it up. Then we will walk up to our first patient. Let's say this lady's our first patient. I'm going to say, is she breathing? Is she breathing too fast? The rate on here tells you, what's it tell you?
30 respirations.
Is it over 30? If she's over 30, she's a red. I'm done with her, I can move on. If she's under 30, then I need to look at her perfusion. Now you can do that one of 2 ways. You can look at it by feeling for a radial pulse, or you can do it by capillary refill. Our capillary refill, basically, if you grab your finger and you squeeze it, it turns all red.
Oh, okay.
How long does it take for it to go back to normal?
Oh.
Okay. Normal is 2 seconds. So if it's greater than 2 seconds, that's considered abnormal. We would make them a red. Okay. If they don't have a radial pulse, they would be a red. You don't check both, you check one or the other. Radial pulses are usually better to check, but if you're not familiar with doing them, capillary refill may be the better way to go. Okay. The other issue with capillary refill is we need to remember that somebody's really old, their refill is not going to be normal. So it may be radial pulse is a better way to go with them. We did respirations. We do perfusion. If their perfusion's good, they have a radial pulse or their cap refill is less than 2 seconds, then we're gonna move on to mental status. What is their mental status? Are you all familiar with AVPU? Okay. AVPU is AVPU, okay? Alert, which means they're looking around at you. Verbal, that means they can talk to you. P is painful, they respond only to painful stimulus, and U is unresponsive. So typically, when we're talking about mental status, if they can talk to me at all, they're an A or a V. If they're not talking to me, or if they only talk to me when I elicit pain on them, then they're a P or a U. So if they're a P or a U, they're gonna be red. If they're an A or a V, they're gonna be yellow. Okay? The green are already out. Okay? So you'll only have yellow, red, or black, which means that they're deceased. Okay? I'm just going to go back up to respirations. If the patient is not breathing when you get to him or her, what you will do is do a head tilt, chin lift. Are you all familiar with that?
Yes.
CPR? And if they start breathing, then they would be a red. Now, normally in a trauma, we do a jaw thrust, but in an MCI situation, we can't do that because we don't have the hands to do it. We use 2 different types of things to actually identify the patients when we do this. Everybody understand RPMs? No questions? We're all good. We use either triage tape, which has green, yellow, red, or black tape, or we use triage tags. Either way, the patient's gonna wind up with a triage tag. But when you have multiple patients, this tape works much better and quicker than these tags do.
Right.
Okay? There's a lot of room to write things on these tags. In triage, we don't write on them. We write on them in the treatment section or when we do secondary triage, which would be the treatment section or the ambulance. Basically, you take a piece of the tape. I'm using green because I have a lot of green because we never use greens. And we put it around their wrist, or we put it, you wouldn't want to put it around their neck, you can put it around their arm, tie it around their arm. You want to do it somewhere where it's obvious that people can see it. Okay? The other issue with using this over that is here we ripped off the tag, so I can throw this in my pocket and I can remember to pull these out and then count how many yellows, how many greens I have. With this, I have to take a little piece and maybe put it in my pocket or somehow keep track, because you need to keep track of how many patients you have, how many greens, reds, yellows, and blacks. Blacks are not as important to the overall, but we need to know the incident commander. There's one person that's going to be in charge, and you have to go to him and say, I have this many yellow, this many red, so they know what hospitals to send people to. Because if we have 50 patients, we're not going to send 50 patients to Ocala. We're not going to send 50 patients to Shands. We have to divvy them up between all the hospitals. So sometimes we have to send them down to the villages or out to Citrus or wherever. The only treatment that you would do in a triage situation, in the start triage, is any major bleeding. What's major bleeding? It's something that they're going to die if you don't stop that bleeding. So if you have a pumper, you have an arterial bleed that's pumping out, that would be controlled. You would wrap it up and then move on to your next patient. Now, the biggest problem with triage, and this is the thing you'll have the hardest time with, and that's what our guys in the field have the hardest time with. You go up and the guy's legs are maybe twisted, they have a broken arm, they have something hanging out of their chest. Immediately, you're like taken back by that injury, and you say, they're red. They might not be. You need to go through your RPMs. All right, today we're going to send you in groups of 2 into the 2 different classrooms. You will have one patient who is actually moulaged with injuries, okay? And you can use your cards. And they're gonna have, the rest of them are gonna have tags, even the person that is moulaged is gonna have a tag. Basically, it may tell you up top here, this particular one says unable to move, no verbal response. It'll give you their respirations, it'll give you their cap refill or radial pulse or both, and then it'll give you the mental